Hello, welcome to this special event, our third online Frontline Club briefing. I'm Naomi, the National Director at Australia for UNHCR. I'd like to start by acknowledging the traditional owners of lands around Australia. I pay my respects to their elders, past, present, and emerging. And thank you everybody for joining us this afternoon. I know we have supporters joining us from every corner of Australia. I know also we have many UNHCR colleagues across the world joining us. Hello and thank you. And also to my colleagues in my fellow national partners, welcome. And I hope you are all safe and well. Special thanks and welcome to our wonderful guests today. Jean-Nicolas Beuze, UNHCR's representative in Yemen, who will be joining us shortly from Sana'a in Yemen. Martin Manteaw, who we see here today. Lovely to see you, Martin. UNHCR's deputy representative in Yemen. Joining us from Melbourne, actually. He's been at home for a while, and we're just so glad that you're with us too, Martin. And of course, the wonderful Astrid van Genderen Stort, who is UNHCR's Head of Marketing and Emergencies, joining us from Geneva. So a truly wonderful global meeting together, and thank you. You all have huge responsibilities in an incredibly complex situation. And now with the global health crisis of COVID-19 overlaid on the many challenges that we know refugees and displaced people already face. So I thank you all for joining us and taking time out from your very busy schedules today. And this is what Australia for UNHCR's Frontline Club is about. In person or online, it's about connecting our supporters around Australia and now the world with those in the field, giving us a chance to hear firsthand what's happening on the ground. And I think it's more important than ever before. I think we're always very proud at Australia for UNHCR that we visit the field a lot to see our projects, to see how Australian donations are being used. Sadly, that's not possible at the moment. But what is great is that through technology now, we're bringing the field to us. So there is a silver lining there. Today, we're going to hear directly from our key staff about how UNHCR is globally coordinating the operation and how staff are coping on the front lines, and in this case, in Yemen. While you're at this briefing, we also have an important job to do, and that is, of course, raising funds for the UN Refugee Agency's global operations to respond to the coronavirus challenge. We're raising funds to provide urgent medical care and COVID-19 prevention measures, including doctors' salaries, hand sanitizer, gloves, and personal protective equipment. Just by giving $100, you can provide 12 medical professionals with surgical masks, gloves and hand sanitizer to prevent the spread of COVID-19. By donating $200, you'll provide primary healthcare services to up to 13 displaced people. By providing $500, you'll help pay the salaries for a medical professional in Yemen. And by providing $6,397, you will be able to help us pay a doctor's salary for 6 months in Yemen. We know this pandemic is pushing health systems in many far more stable countries to the limit. A country like Yemen needs all the help that we can give. If you can, please click through to the donate button, which I think you're seeing on your screens now, to ensure that displaced people in Yemen have the help and medical support they need to be safe and well, and indeed to stay alive. If you have questions, please type them up in the chat function. You should be able to see that on the bottom of your screen. Have a look now. Yep, I can see mine. And we'll try and get as many of your questions answered too. We're going to make sure that we've got time for that. But first, I wanted to go to the big picture and see what's happening worldwide. And so, Astrid, if I start with you, Can you describe for all of us today the current impact of coronavirus on refugees and displaced people worldwide from UNHCR's perspective?
Yeah. Hello, Naomi, and hello, everybody. I'm so happy to be here today. The current impact of the coronavirus is, of course, huge. It's huge for everyone, and I think we have to keep that in mind. It's coronavirus does not discriminate. So as much as it impacts us around the world, and maybe in some areas around the world at the moment, it's going. We're getting out of isolation. It's getting a little bit easier. It's still huge around the world, whether it's for refugees, whether it's for our people like our non-refugees, basically. It's the healthcare has been the same for everyone, and of course also for refugees. However, the difference is that, well, first and foremost, I think we have to keep in mind how many refugees and displaced people there are in the world. 1% of humanity now is displaced. These are people that would love to be like us at home, to be able to protect ourselves, to be able to take care of ourselves, maybe to go to the hospitals that we're used to, maybe to go to the doctors that we're used to have to be in the safety of our own confinement. But these almost 80 million refugees and displaced cannot do that. They live in as said, they were forced to flee. They cannot, in the places where they are, they cannot social distance. They cannot hand wash. They cannot access most of the health services because they're a guest in a country, often in countries where the health services themselves are not particularly up to standards or can hardly service their own populations, let alone the refugees that are there. Refugees, the other problem that they face is that at the moment we see, and of course this is very understandable, that a lot of borders are closed. So for those who flee, who are really fleeing danger, and as I said, not because they want to, but because they have to, they cannot enter other countries. So they find themselves stuck. Of course, on top of COVID, I mean, at the moment, I think maybe what has been, and I'm crossing my fingers every single day, we've not seen major outbreaks in the refugee camps. We've seen, we've seen COVID arrive in camps like in Cox's Bazar in Bangladesh and in Africa, and we've worked so hard to prevent COVID from breaking out. And so far, we have succeeded on this, but I'm crossing my fingers because the numbers of COVID are still on the rise. We see that in the Americas, in Africa, COVID cases are increasing, and so we don't know if this is going to further affect refugees and displaced. Then other issues that, of course, are important and we should not forget is that the socio-economic impact of COVID is huge. And as we always say, poverty often strikes before COVID does. So a lot of the people, isolated now, who are dependent on the little money that they maybe can gain. And many of the refugees are maybe doctors, teachers, whatever. But when they flee, they cannot actually do that job. So they're relying on other little jobs to get extra money. They don't have that extra money. So we see already in Syria, for example, 80% of the displaced and the refugees in the neighboring countries that are under the poverty level and are even further disproportionately affected right now. And we fear definitely also for the future that is to see the impact not only of COVID but the socioeconomic impact. And just lastly, and then I'll stop on this one. COVID is there; it's one emergency. But there are many other emergencies. There's Syria, there's Yemen. We have our dear colleagues from Yemen on the line. Just over the last week, thousands of people came from Cameroon into Nigeria. The situation in the world doesn't stop. So it's an emergency on top of an emergency, and it's really difficult to serve all these emergencies. Of course, we need money to do that, but we need also to have our staff to do that, and even our staff is affected by COVID. So a lot of problems. I can say many more, but I'll stop here for the moment.
Yes.
A lot of problems, and especially a strong, negative impact on refugees and displaced.
Okay, thanks, Astrid. And look, I see from the chat some of you joining are having a bit of trouble logging on. Lee is suggesting if that's happening for you, that you try logging out and logging back in. We had a little bit of trouble ourselves getting in, but we did eventually. So we know this platform for work will work. So please be patient and keep trying. And Lee will certainly assist you trying to make sure that you join us. Astrid, just another question. UNHCR, of course, has had to cope in the past and still doing so, certainly in parts of Africa with Ebola, with outbreaks of cholera, with SARS. How well prepared was UNHCR for this situation that we face with COVID-19?
Well, I think nobody was prepared for anything, just like we were not prepared in the developed world to deal with COVID.
Yes.
But yes, we were prepared in the sense that we knew what is important is to immediately start to put preparedness measures in place to make sure that we engage the community from the start. That we put the priority on health services, that we continue to access for inclusion into health services with the government. So there's a lot of lessons learned, which of course we've also learned from our long experience with refugees. I mean, refugees come into other countries, and while maybe the traditional way has been we should provide assistance to refugees, and humanitarian agencies come on the ground. In recent years, we've really much more focused on how can we integrate refugees into the health services of a country.
Yes.
So these are of course, and it's very important because they have to become part and parcel. And that's not just like not us asking refugees should be integrated, you just have to help them. No, it's us supporting also governments to help refugees integrate. So it's a two-way thing, and trying to provide similar services to host communities and to refugees. So yeah, we were. I mean, were we prepared? It's been a race around the clock. We have Jean-Nicolas, who when I turn off my camera, he will come on, but and Martin, who are one of two of great examples of staff who have actually stayed in countries where even for themselves it's been incredibly difficult because they are just as scared by what has happened around the world with COVID. They also had to protect themselves and see what to do. They were worried about their own families and friends in other countries, yet they stayed and deliver in the more than one of the 134 or even more countries where we're working at the moment.
Yes. And
so
Astrid, could you just also give a bit of a scope about the and we are raising funds, but globally, what are the needs for UNHCR to respond to this for displaced people and also the host populations that, as you've described, we also support?
Yeah, globally, the needs on the COVID response are huge. We started quite small, and we went up quite immediately to an appeal of $745 million, not dollars, $1 million. So the needs are enormous. As I said, we're in 134 countries. We need to put preparedness measures in place, which is building, hand washing sites, isolation centers, support the health structures, massive airlifts of PPE equipment, protective gear, masks. But it's also things like cash support to refugees and internally displaced, because these people are, as I said, they have no access to livelihoods and any small jobs, and they need to survive through this period of where many people are in lockdown, in isolation, still around the world. They need to pay their rent. They need to be able to to survive. So that's. But then there are other things that we're doing. We're informing refugees around the world what they have to do. and provide them with the information, because often, you know, in some of the places where we are, access to internet is hardly available. So we have to find ways to inform refugees what they have to do, how to clean, how to be, you know, how to prevent themselves from getting COVID, or what to do if they get COVID. And then it's support to the health structures. It's you know, a lot of these different things, and you know, these yeah.
Before I come to Martin and Jean-Nicolas, we are getting questions through the chat function, and if you want to ask a question, you can see at the bottom of your screen where you can click and do that. We're getting some excellent questions. One of those questions that just came through, which I'll grab you while you're still there, Astrid, is, and it's a big one, what existing flaws in the international refugee system has sort of the global response sort of revealed? And I guess that's a question that goes to how, you know, as we know, UNHCR doesn't do this alone. It works with many partners. Has that been a strength, or even in this space of the 3 months, what have we learnt about that?
We've seen highs and lows in the past 3 months, as we've seen in our history working with refugees. I think one of the great things has been the interconnectedness and the sense of solidarity we felt around the world. I was personally very touched because as we are all so much affected by this and afraid for our families, and as I mentioned before, you know, self-isolating and really looking at how we can take care of our own families and loved ones, we've seen an enormous support for refugees around the world. We've seen, I mean, our efforts have been funded. There has been solidarity, there have been outreach, there have been people who have been lobbying on our behalf, who have been advocating to keep borders open, et cetera, et cetera. At the same time, of course, because of this fear, we've also seen, you know, flaws in the systems. And one of the examples I gave before is the borders that have been closed. And while this is so understandable, people want to keep COVID out. You know, there is this problem. I mean, if people flee, there are other ways that people can be provided access and be given asylum in another country. There can be tests can be done. You know, a lot of things can be done and still provide that protection to the people who really need it. And we always have to keep in mind, I mean, and I say this again and again wherever I am, this, you know, a refugee doesn't choose to be a refugee, he is forced to. And this is something that can happen to us, maybe not tomorrow, but it has happened to us 40 years ago, maybe during the war, or it's longer than that, but and it can happen to us again and again. So we have to keep in mind that solidarity is important, and there is and refugees have the right to seek asylum. And while there is a massive pandemic and healthcare, keep this in mind. Just one other thing, I mean, another positive I think I've seen is that under the pressure of this pandemic, we have seen that some things were possible that we've been tried to lobby for years. For example, in Greece, where refugees stay in totally overcrowded, impossible refugee camps, we've been able to relocate some of the people. We lobbied it, as I said, for years, and we've been able to resettle unaccompanied minors to countries in Europe. And these are breakthroughs that we managed to get in these COVID times under the pressure of COVID. So,
yes.
I mean, good things and bad things.
Yes, fantastic. All right, thank you, Astrid. I'm going to come back to you a bit later, but I'm going to ask Jean-Nicolas to join us. And while we're doing that, I've just got another reminder that we are raising funds to provide urgent medical care and COVID-19 prevention measures, including doctors' salaries, hand sanitizer, gloves and personal protective equipment. You'll have on your screens now a button that you can press to donate and support UNHCR's work right now. $100 will provide 12 medical professionals with surgical masks, gloves and hand sanitizer to prevent the spread of COVID-19. $200 can provide primary healthcare services to up to 13 displaced people. $500 can help pay for a medical professional in Yemen, and $6,397 can pay a doctor's salary for 6 months in Yemen. Which are all like really, really important things, and for a relatively small amount of money, life-changing. So please click the donate button if you're able. So I see Jean-Nicolas, welcome, and it's great to have you and Martin here today. Thank you so much. As we said in the introduction, we're just delighted that we've had so many colleagues be able to join from around the world. Let's come to Yemen, and I think one of the starting points, we hear about it a little bit. It is sometimes I think one of the invisible emergencies, but it's one of the major humanitarian emergencies that are happening in the world right as we speak. I wanted to start with looking at a map. Because people often ask me, where is Yemen? And maybe, Martin, if I could start with you, I think just to describe, and this is a map also highlighting where UNHCR's operations are, I think. If you could just describe where that is, where the displaced people are on this map, and indeed where refugees, who must be very desperate, are crossing over to try and find some kind of refuge in Yemen itself, which is extraordinary. Martin, I need you on microphone. If you unmute.
Thank you, Lee, for the floor.
Perfect. And, leave from the floor, definitely.
Sorry. Yeah, Naomi, thank you very much for that introduction. I also thank our colleagues who have joined around the globe, as well as our very generous donors. You're all welcome. Basically, our operations in Yemen is mostly around the eastern, the northern, and the southern parts of the country. The western part is reasonably, we are not very present there. But before I go into the details of where we actually are, I just want to position Yemen for our viewers or our listeners to be very mindful of. As Naomi mentioned, just across the strait there, you have Ethiopia and Somalia, particularly to the southeastern part of Yemen, just across the sea. And then at the very north of it, you have Saudi Arabia, and of course, Oman to the west. Now, we all know the situation in Somalia. So a large population, a large percentage, about 90% of the refugees that we have in Yemen are from Somalia, right? They just cross over from Somalia across the sea, and they are in mostly the southern part of Yemen. And then, of course, we have some small percentage, about 5% or so from Ethiopia, as well as a small minority of refugees from Eritrea, Syria, Iraq, and the rest. So that's our refugee population, which numbers some 280,000 refugees. Our presence in Yemen itself is, as I'll start from the center. We are headquartered. Our branch office is in a place called Sana'a, which obviously is the capital right before the war, and it still remains the capital, but it's now occupied by the Houthi authorities, who are obviously not recognized by the international community. So the government, which basically is the Yemeni government, is actually now residing in Aden in the south. Now, we are in Sana'a as our head office, and we are there with a number of other UN agencies and a number of our donor community, as well as our NGO colleagues that we work with. And we are there, we coordinate all the activities from this place. But dotted on this map is our presence in the north, which is a place called Sada. We have a field office there, and our team there literally support hundreds of thousands of displaced population in places like Al-Jawf, Marib, and so forth. And then we have another office, which is a field office in a place called Udeda. You can see it on the coast of the map. And that's where we run our operations to support all the displaced population in places like Hajar, in places like Abs, as you can see in the map there. And then at the central part of the map, just not actually, it's more sort of central. Okay, we call it IB office. Here we have another field office that again helps us deliver services to our population of concern, which is basically the IDPs in this area. And then to the south, as I mentioned at the very beginning, is where we have a very high concentration of Somali refugees. And here we have a camp in a place called Paras Camp, and we host our refugees there. But the vast number of refugees, over 90%, are urban refugees in Yemen. They reside within certain localities, and they have concentrations in these areas. And this is where we go and provide services, or they come to our various community centers that we have dotted on the map. In fact, if you look carefully, these are the triangles, red triangles, or I would say maroon triangles with white dots. These are various community centers where we provide a whole host of services, be it legal assistance to refugees in need of getting their ID documentation, or getting evidence of their rights to certain property, and so forth and so forth. So broadly speaking, this is where some 290 UNHCR staff work within the country of Yemen, with some 30 odd national NGOs that then go out and deliver most of the services to our population of concern.
Thank you, Martin. And Jean-Nicolas, the UN made an extraordinary appeal over the weekend that did get some coverage in Australia about the really dire situation in Yemen, and the need for immediate humanitarian and upscaled support. Can you describe what's happening on the ground in Yemen right now?
Yeah, good morning, Naomi, and good morning or good afternoon to everyone, especially our friends from Australia. Martin and I are seasoned humanitarian workers, and I'm pretty sure that Martin will agree with me that when we stepped foot in Yemen, we were quite puzzled by the amount of humanitarian needs and the dire situation. The individual tragedies that are reported to UNHCR, the UN Refugee Agency, on a daily basis are really breathtaking. Imagine it's a country with 8 out of 10 people who relies on external aid for their daily survival. Without the humanitarian partners, without UNHCR, 8 out of 10 people in Yemen will not be able to feed their children, their older elderly parents. The number is just astronomical. Now, I know that in Australia, you have been recently, some of you, unfortunately, been forced out of your home because of the fire, the bushfire. And it was quite also breathtaking image to see Australian on the road. So imagine in Yemen that 1 out of 8 Yemeni has been displaced by the conflict. Same situation, you lose everything in the blink of an eye because of the bombing, the shelling, the fighting on the ground. 1 out of 8 Yemeni has been displaced, but instead, like Australians, we were perhaps able to find a room with friends or relatives, or for the poorest of them, eventually had a school being open to shelter them for the night. In Yemen, this is impossible. You get your house destroyed, you live in the open, you live on the street, you live in the middle of desert, you live in the middle of flooding. 2 months ago, we had flooding in here, even in Sana'a, and it was really impressive because it's flash flood, which is really taking everything away. If you live with just a plastic sheeting tent above your head, you are completely exposed to the element. So that's the situation of Yemen. We have on one side those 280,000 refugees that Martin mentioned. It's a relatively manageable number if you think about it. We're not speaking about the Syrians, 3.6 million Syrians outside their country. We are nearing 4 million of Venezuelans outside their own country. So 280,000, it's not such a big number, so to speak. But it's a big number when they arrive in a country where already 8 out of 10% of the population cannot survive without us. It's the second largest Somali refugee population after the big camps of Dadaab and Kakuma in Kenya that I'm sure our friends online have heard and seen the picture, because those before the Rohingya crisis, which is very close to the heart of Australian, those were the biggest camps that we had. But what is really tragic, I think, in Yemen is the displacement of Yemeni by the conflict, and the fact that with the lack of funding and the coronavirus, as Astrid mentioned, a crisis within the crisis, people are really in a desperate situation. And we really fear, we're not speaking about months or years here, we really fear that in the coming weeks, the death toll will increase because we cannot feed people, we cannot help them to go to health center. Half of the health centers have been destroyed. We cannot even provide them with this emblematic plastic sheeting of UNHCR just to put a roof above the head of people. How do you want to protect your own family from coronavirus when you don't even have a safe space, a space where you can wash your hand, a space where eventually if somebody feels sick, you can put that member of the family a bit aside so that it does not infect other members of the family. That's the tragedy of Yemen today.
And it's also true, you know, across the world, the impact of COVID is not just a health issue. It has an issue on so many things, for students being able to go to school, for parents being able to earn a livelihood, on mental health. You're obviously seeing some of those issues there also in Yemen, and probably worse.
So one thing which is interesting and which was uncovered once again for population on the movement, refugees, migrants, internally displaced, is that they are always the scapegoat for everything which is happening. It's very easy to finger point at them as responsible for bringing the virus into the community. We have heard that in the Western world, in Europe, we have heard that in North America. I don't know whether that was also a politicization of the issue in Australia. But we know that the scapegoating of people who are on the move is often happening. And with the coronavirus, there is an element which is true. The coronavirus travels, and it travels with people who are moving around. And so there is this perception in Yemen that refugees, and particularly because they come from Africa, and there's an element here of racism which comes on top of it, were the one who brought the coronavirus into Yemen. So there's an element of discrimination. There's definitely an element of capacities of those population to prevent the spread of the coronavirus. How do you say to somebody, stay home, when the only money they get to feed their kids is the money they earned the day before by going out of their home and walk, or even beg on the street, or walk on a market, or offload trucks, because the refugees and the IDPs are always working in low-skill labor. They don't have a bit of money at the bank that they can rely on. They don't have a social protection safety network by the state to say if you lose your job, you will be helped on your rent, on your food, on your medicine. No, they rely on the money that they have earned the day before. So stay home was absolutely not something we could tell decently, I mean, honestly, to the people. Then you tell them, wash your hand regularly. Fine, but we don't have running water. So it's impossible because you have to fetch the water away from your house. And the little water that you have, you will probably wash your vegetables and your food first. Why? Because we still have cholera. And if you don't wash your food properly, maybe you may avoid by washing your hand COVID, but you will get cholera. So it's a double-edged sword in a way. And the refugees and people displaced face the discrimination, but also do not have the means to actually have the preventative measures that you and me and all our listeners, I hope for them, have been able to adopt to protect themselves and their loved one from the coronavirus. And the third point is the point that Astrid was mentioning. They are the poorest of the poorest. When there is a slowing down of the economy, they are the first one to be let go. They're the first one not to have any job anymore. There is less traffic of trucks because there is less trade. So all those manutentioners, those who are offloading the truck, no job. They are kicked out of the street where they were begging. They cannot eventually go to the mosque where, through a long tradition of Islam, you can be fed, because there's a tradition of feeding the poor at the mosque, but you cannot go to the mosque because going to the mosque is being in a crowd and therefore taking a risk. Or there has been restriction of movement by the authorities as a preventative measures. So all combined, we can really see that the refugees, the Yemeni displaced by the conflict are amongst the most affected by the coronavirus today. And as we will come back to that, it has affected also the way we operate in Yemen.
Mm-hmm. Yes, and I'm going to ask about that, and I might come to you, Martin. I mean, our Australian donors through Australia for UNHCR have raised to date more than 2 million Australian dollars for UNHCR's operations there, which is an amazing result. And I say it's amazing, and it's not only a generous response, but also in spite of, you know, as we know, often very little coverage of the situation there. But for UNHCR, in terms of that operating environment, can you describe how you use the funds, and not only how you use them, but I guess how you navigate, complexities there? You're dealing often between the north and south, different authorities, different militias, it's very, very complex. So could you talk about that, please?
Okay, thanks again, Naomi, and thanks to our donors for the generous donations that they've made so far. Indeed, the situation in Yemen is very complicated, as Naomi has alluded to. We navigate the government in the north, which is basically the Houthi movement or the rebel government, as well as the actual internationally recognized government in the south. And to do this, we have to have skills of always negotiating and coordinating in such a way that we don't rile off the other party against the other. But that's probably not the biggest of the challenges. The biggest of the challenges is exactly what Jean-Nicolas has alluded to earlier, and that relates to the fact that basically 1 in 8 persons in Yemen relies on some sort of aid. And how are we getting through to deliver this, particularly in the recent current environment of COVID? When this whole COVID broke out, we had to change our way of operation largely. And we started with massive campaigns to the communities that we serve, the refugee population, the IDP population, and we made sure that these messages are basic, but some of these people don't have any means of coming across this information. So we printed a whole host of posters and cards that we were going around distributing, showing them practically how to wash your hands, how to distance yourself, how to make sure that you don't touch your face. These were the messages that obviously the WHO had propagated, and we made sure that our communities receive this information. Not only did we do that, we also set up hand washing facilities in the various sites, in the various refugee communities, to make sure that people can wash their hands. We distributed, it's one thing washing your hand with water, but there is the need for soap. So we distributed a lot of soap to make sure that people are able to wash their hands properly. And in addition to that, we procured a lot of what we call the masks that our health and our health workers, as well as our partners, because remember, as I mentioned at the beginning, we use partners to deliver a lot of the services on the front line. And if these partners are going to go to the communities to assist, and they don't have the PPEs that are necessary, then they cannot be safe themselves before they can assist the refugees as well as the IDP. So we bought a lot of PPEs, and that we distributed to our various partners to make sure that they can go out there and deliver these services accordingly. So just to come back to the crux of the question, what are we using the money for? We providing a whole host of services in the form of shelter. Jean-Nicolas alluded to it earlier, where basically we provide the IDPs with a place to stay in the form of plastic sheeting, in the form of wood, in the form of nails and so forth to pitch their shelters. We provide them with what we call the core relief items, and this includes blankets, mattresses, plastic sheets, kitchen sets, and lanterns, so that they will be able to survive the few days that the initial period of their fleeing from the war, the conflict, or even arriving from Somalia. And these are the things that we're using the funding for. But as I said earlier, in the immediate last 3 or 4 months, we have been very much focused on trying to help our populations of concern to deal with the outbreak of the COVID pandemic.
Thank you. It's we've just had on World Refugee Day the Global Trends report. Again, now we know there are nearly 80 million people displaced worldwide. In Yemen alone, 24 million people and 20 million, facing food insecurity, severe food insecurity. These are big numbers, but it's often the human face. I guess that's the most impactful. You've both lived and worked there for some time. I might start with you, Jean-Nicolas. If there's any particular person or family that sort of really brought home to you the situation there and the humanitarian face of Yemen at the moment.
So the situation that we are facing is really one which is compounded by 2 elements. It's a very difficult working environment, even prior to the coronavirus, because it's an active conflict. And I think a lot of people tend to forget that Yemen conflict has displaced the 4th largest number of civilians in the whole world. First is Syria, second is Colombia and Congo. But the 4th country where civilians have been displaced by the conflict and have remained within their countries, because we saw the map, there's not many options to escape and to cross an international border. Yemen is the 4th largest internal displacement. So it makes our life very complicated because we have security issues, but we are also operating with different authorities. Martin referred to the fact that the country is divided and there is control of different armed groups, officially recognized government, many splitting groups within the internationally recognized government, the Houthi on the other side, and there were questions on the chat about the role of Saudi Arabia and others in the conflict, and it is a proxy for the regional powers and potentially even the international powers. There is an element of tribal fight within the communities in Yemen, but it's a proxy for a fight between different constituencies in the Arabian Peninsula and beyond, supported by the Western world and supported by Russia on the other side. To oversimplify, it's a fight between Iran and Saudi Arabia, if you wish. Of a control of Yemen, especially because there is potential oil resources in Yemen. So on one side, it's a very non-permissive environment, very difficult security-wise in terms of having to negotiate with all the authorities to have access to the people, having obstacles put to us to have access to the people. But on the other side, and it's not because we are speaking to our generous donor today, but it's also a money issue. We don't have enough funding for us to be able to deliver basic life-saving intervention for most of the population. Because of the...
And what is the gap, Jean-Nicolas? What is the gap between what UNHCR currently has and what you say?
So we need 250 million for the whole year, and we have received 70 million. So we are at 30% of what we need. 30%, but we are halfway through the year. So it's very worrisome because the money normally is received at the beginning of the year so that we can plan our activities until December. If you have only 30% of the money in June, you need to make quite drastic choices. Martin and I, with the rest of the colleagues, had to decide, do we give a plastic sheeting tent to a single woman with 3 children? Or because we don't have enough money, we give only plastic sheeting to a single woman with 7 children. And the one with 3 children, sorry, we don't have the money. We need to prioritize on the one who we expect, because she has more children, to be more vulnerable. Do we decide to help persons with disabilities, or it's way too costly to help them having rehabilitation services or wheelchair or psychological support when a child has stepped on a landmine? Or do we say, no, it's more important to give money to families to buy food? So those have been the ethical questions that we have put to our teams and said, we don't have it, we won't be able to cover all the needs. So we need to decide who we prioritize first. And this is quite a daunting task, because you are deciding in a way who is going to live or not, who is going to survive. Most of the people will, I hope, be able to survive, but at which price? It means for a family reducing their food intake. It means for a family marrying off their little girl at the age of 12, because it's 1 mouth less to feed in the family. It may mean for some to send their young kids to join an armed group, because the armed groups, they have food, the family doesn't. So perhaps the kid is better off, in the mind of the parents, with an armed group than with his own family. Imagine the consequences and the choices for those parents, those families, to make in order to survive in a country like Yemen. So the two elements of having a conflict, of having very difficult authorities to deal with the fact that we don't have enough money, is a recipe for humanitarian catastrophe.
And it's a hard question, I guess, Jean-Nicolas, but you know, it is about you know, money. It is about humanitarian support, but longer term, it is about trying to get some peace and security in Yemen and some stability. Do you see any positive signs that may happen?
So there were a lot of questions, Naomi, on the chat bot about the peace prospect. So we have been in a situation where the United Nations in particular are trying to bring the parties to conflict to the negotiating table. It's very difficult in a context like Yemen, where you have at least three main parties to the conflict. So the Houthi, the de facto authorities in the north, who want to impose Sharia law, who have a very conservative approach to life and to gender issues. There was a number of questions about women. Yes, women are disproportionately affected by the conflict, but by also social cultural norms. They are not really religious norms. They are more social cultural norms, which put the woman, sorry to say, but in the kitchen, with no access to the public life, with no access to jobs and so on. You need a male chaperone for almost everything, even to give birth, even to go to the gynecologist, you need a male chaperone. Even if you need to complain about a rape, you will need a male member of the family. And when you know that rape is considered in this part of the world as bringing shame to the family and leading to what is called so-called honor killing, it's impossible for a woman to take her husband or father and say, I've been raped, because there will be an obligation, a moral obligation, if you wish, on the part of the male to actually kill that woman who was brought allegedly shame on the family. So there has been attempts to bring the three parties to the conflict to the negotiating table, but on top of that, we have also the tribal dimension. The society in Yemen, like in Afghanistan, like in Somalia, and it's sometimes something that we Westerners forget, is built on different parameters than our democracies. They don't elect members of parliament. They don't choose their ministers. They don't vote. It's based on a tribal structure where the clan leader is the one supposed to provide you safety, but also for your well-being. And it's a multiplication of clans in Yemen with very strong and solid tradition, and actually beautiful tradition, some of which are also protecting the weakest member of the family or the weakest member of the communities, sometimes denying the right of those weakest members of the community, such as women, for example. But there is also really positive tradition. For example, they have mechanisms to bring peace between two tribes. So we have those two layers of the big parties to the conflict, the Houthi in the north, the recognized government in the south, an independentist movement in the south who wants to partition the country. Because let's remember, 40 years ago, Yemen was not Yemen. It was two different countries that once again, the Western power in their greatness, I'm being ironic here, decided to draw the map of Yemen and decide what Yemen was all about. That sounds very familiar, I think, with anyone familiar with Africa and the Berlin Conference at the time in the 19th century. Anyway, just to say, it's extremely complicated in this context to bring peace. But without peace, we won't be, you're right, Naomi, and all the friends on the chat, you're right, we are never going to be able to tackle the root causes of the problem. The conflict is the driver of the underdevelopment, the poverty, the lack of sanitation, the absence of health services. But for us, humanitarian, we don't engage on the politics. You know well what our former High Commissioner said, Mr. Gutierrez, who is now our Secretary General. Don't ask the humanitarian to be politician. Leave to the politician and the diplomat the responsibility to make peace, to eventually ascertain accountabilities, because we need to hold accountable those parties to the conflict to all the horrible human rights violations that we have witnessed. we humanitarians have to alleviate the suffering. And as we speak now, we are not able to do so because of the lack of funding put at our disposal.
Yes, yes. All right, look, thank you. I think we've only got two minutes left. Martin, I don't know if there's any final comment you want to make. Astrid, I've got lots of questions, but we're going to have to save that for another special webinar with you. But Martin, anything you would like to say to Australian donors?
I would like to just say again that we are very, very grateful for the donations that we received so far. And indeed, we need your support to continue to assist the very many lives that we impact on in terms of shelter, in terms of providing them with the basics of life, in terms of providing them a sense of just being human. You know, when you're displaced and you don't have a place to put your head, you don't have something to feed your children, you don't have a place to send your children to school, it is almost impossible to consider yourself as living. And indeed, if we can make a small impact, a small difference to the lives of these people, it would go a long way to establish their humanity. So again, we thank the Australian community and those generous donors, and we hope that they would continue to support our work in Yemen, particularly in this current COVID environment.
All right. Okay, well, look, I have to unfortunately close our webinar today. I am going to thank you, but at the end of the webinar, we're playing a short video, which not only shows UNHCR's work, but I think also gives the context much more for the situation in Yemen. Thank you, Jean-Nicolas, Martin and Astrid. And thanks to all our supporters and friends who've joined us both in Australia and worldwide for another event at our Frontline Club. Combating the outbreak in refugee communities of COVID-19 requires a huge global effort. The challenges we know will continue, but I know our teams, some of whom are led by our really inspiring guests today, are absolutely committed to doing everything they can to support refugees and displaced people facing this huge challenge. And in times like this, it's so important that we all look out for each other, particularly the most vulnerable amongst us. Thank you, everyone, for standing and continuing to stand with refugees and displaced people. Thank you.
Thank you all.
Merci, à bientôt. See you.
Thanks, Astrid.
Thank you. Thank you very much.
Bientôt.
Yemen is one of the worst humanitarian crises, with people dying every day from the conflict, from communicable disease, from famine. So coronavirus is really the straw which may break the camel's back. It is a daunting task to put together a coronavirus response in a country like Yemen. We had to adapt all our activities so we can still deliver emergency kit, cash assistance, protection services to 3.6 million internally displaced, but also 280,000 refugees, mainly from Somalia, in a safe way. It is very difficult for them to have access to running water and wash their hands regularly. Therefore, it was important for UNHCR to distribute hygiene kits, but also to advance a little bit of money to this population so that they can go through the COVID period in a safe manner and can still buy a bit of food, medicine, clothes for their children. We know that we can save life here, but we don't have sufficient financial means to do it. Without your support, we cannot continue saving life. In time of crisis, we stay and deliver.
Naomi, we can't hear you.
It looks like Naomi left.
I think it's the end. So greetings from Sana to all the participants, and we remain at your disposal. If you need further information, get in touch with our UNHCR for Australia for UNHCR colleagues, and we'll be happy to respond to all your your queries. We hope that those who can afford to give a bit of their savings to UNHCR or other partners in Yemen, please do it. It's worth it. Every penny makes a difference in the life of Yemeni children, families, as well as the refugees that are hosted by the Yemeni communities, for which it's a real burden. So if you can, please help us. You are going to save life. I assure you that.